Okay.
for our student purposes.
Sure.
And if you give me a second, I'm gonna wash my hands, so I'm gonna lay my stuff out, and then we'll start the interview,
All
okay?
right, Joey, thank you.
I just wanna get everything out just in case I need it.
Sure.
May not need it, but okay. Just picking up just a little bit of equipment here.
Sure.
I think that's pretty much. If I need anything else, then I go back into the bag. Okay, let me go ahead and wash my hands. Just use a half contact. Okay. My hands are usually cold.
All right.
So feel them to be cold. Okay. Again, my name is
Hi, Joey. I'm Eugene. Nice to meet you.
Eugene?
Eugene.
Nice to meet you
You as
too.
well.
Can you tell me your date of birth?
Oh gosh, 8/11, 19. What year was I born? 1980. 82. Yeah.
Okay.
It's my close.
Okay, then. Do you still work?
I do. I work part time. I'm a waiter at Cafe Wawa, and I go to school to be a paralegal.
Okay. Are you married?
I'm divorced of 5 years. I was married for 10.
Okay. You have any kids?
I have a 10-year-old that I take care of. Actually, in partnership with my ex-wife.
Okay, boy, or girl.
A girl.
10 years old.
Yes,
Okay,
I am.
that's awesome.
Yeah.
What brings you to the clinic today?
Came in for a follow-up. I was here a few weeks ago, felt fine, had some blood work done, so came back to get the results, and I've been feeling a bit tired recently, and just not my normal self, and going to the restroom a lot, like every 10 minutes. I'm not sure what's happened in between.
So when you say a few days, was it a few days, weeks, or months? Do you know when it began?
About a week ago.
About a week ago? Okay, and I said, are you urinating or are you having bowel movements?
No, urinating about every 10 minutes.
Okay, are you having any pain when you urinate?
No.
Okay, so is that going all day, throughout the night?
It's pretty consistent. Yeah. Day and night. Yeah.
Okay,
Especially at work, and I'm having to wait tables. So I have to have my co-workers take over my tables when I have to go to the bathroom. It's something, I just feel something's not right.
oh, okay. Well, let me ask you something else. Are you having any other associated symptoms, like are you sweating? Are you drinking a lot of water?
I do drink a lot of water, yes. Lots of water, and then I'm going to the bathroom, no pain. Yeah.
Okay. Are you eating a lot? Your appetite, has it increased or decreased?
I'm eating a lot of red meat. Yeah.
Okay. Okay. All right then. So I was looking at your electronic health record, and I'm just gonna go ahead and just ask you some questions
Okay.
before we get really involved into it.
Okay.
Okay. Have you ever been in a hospital before?
No.
You never been in a hospital before? Have you ever had any surgeries?
No.
No surgeries. Do your parents have any illnesses?
Yeah, my mother, she has a history of diabetes. My dad has high cholesterol.
Are they both still living?
Yes, my mom is 60, my dad's 65.
Okay. Do you have any siblings?
I have a younger brother and sister.
Do they have any health problems?
Not that to my recollection. No.
Okay. Are you let me see, do you drink alcohol?
I do about 3 times a week.
Do you smoke?
No.
Good job on that.
Never.
All right, I like
I
that.
can never inhale.
What about, do you do any recreation
No.
drugs?
No,
Do you have any friends that do any recreation
No.
drugs or smoke? Okay, then, good. Do you have any, I'm just going through the history and physical
Sure.
right now, just some of the questions that we need to ask before we actually go into the exam itself.
Sure.
Are you up to date on all your vaccines, like your childhood shots and?
Yes, I think so, yes.
Have you had the pneumonia shot ever?
Yes.
Okay, do you remember when?
It's been a few years, and I don't remember exactly when I've been.
Okay. Okay. They're usually good for about 5 years, so if it's been over 5 years. we
No,
may
it's
do
been
this.
less than that.
Okay, well, good, then you should be okay with that. Do you get the yearly flu vaccination?
Absolutely.
Okay.
Yes.
Have you ever had a TB test done?
Yes.
Okay, everything was good with that?
Yes, ma'am.
All right then. Okay, you seem like you're on the right track.
I hope so. Yeah.
Okay then.
Yeah.
Just going down thinking, do you own a gun?
No.
Okay, good, because it's good then we have to have that in a safe box.
Sure,
Make
of course.
Okay. Another thing I wanted to make sure, was, are you wearing your seatbelt?
Interesting question. Always, yes.
Always wear your seatbelt. And the reason why I say that, because you'd be surprised how many people, do not wear their seatbelt all the time. They say I put it on sometimes. So a lot of times we like to make sure everybody's safe all the time. And also, I'm just gonna go through your systems right now, and anything else comes to my mind, I may come back to you and ask you more questions as we go. Another thing, going back to the vaccinations, have you had a tetanus shot in the last 10 years?
Yes.
Okay, good. So you're on top of
I
it.
am.
All right, then. Okay, so I'm gonna ask you, are you having any blurred visions?
No.
Any blurred vision, any headache?
No.
Any trauma to your head?
No.
Any ear pain?
No.
Any problems with your nose?
No.
Okay, when the last time you had an eye exam?
Oh gosh, it's been probably about 2-3 years.
Okay, how's your vision?
It's pretty good. I think it's almost a 20/20, but I'm not sure.
Okay, we'll probably be able to check that in a little bit to make sure it's okay, okay?
Sure.
Any problems with your mouth, any chewing or swallowing problems?
I have Bell's palsy.
Okay, that cause you a problem to swallow?
More just chewing.
Just chewing, okay. When the last time you been to the dentist?
Oh gosh, it's been recent.
And I'll explain to you that in a little bit while we ask those questions, just once I get through the exam, and then we can go back and talk about some of that.
Absolutely.
Okay, have you had any shortness of breath with everything that's been going on?
No, not that I remember. No.
Any chest pain, irregular heartbeats?
Sometimes when I go to the gym about once a week, I like to kick up my cardio, but that's about it.
Okay, so you do exercise once a week?
Yeah.
Okay, then. Any chest pain when you exercise, just a little bit regular?
My heart rate just elevates a little bit. So when you do cardio,
Oh yeah, it goes up. So that means you're doing it right. If your heart rate goes up when you're exercising, then you're doing it right. But when you rest, it comes back down with no problems, right? Okay, then. What about any stomach pain? Do you have any stomach pain?
Not that I can recall.
When was your last bowel movement?
Last night?
Last night, okay. It was normal, no
Yeah.
problems. Do you normally go every day?
At least one. I think one time a day.
One time a day, okay. And we already talked about the urination part. That's frequently, and that's kind of bothering you right now. That's the reason why you
Right.
particularly came
Yeah, just
in.
really the consistent every 10 minutes. It just seems awkward.
Right. What kind of health problems do you have? Have you ever been
That's-
diagnosed with anything?
No, no. It's just the consistent urination and just not feeling a little fatigued.
Okay. All right then, because you said you was here a few weeks ago, but
Yeah.
was that just a physical, or were you having a problem at that time?
I was just coming in for blood work.
Blood work. What blood test did they tell you they was giving you? Do you remember?
Not off the top of my head.
Okay, we'll talk about that in a little bit. Okay. All right. Are you having any problems with your fingers? Any tingling, any numbness with your fingers?
No, not at the moment. I'm not.
Okay. Do you have any skin lesions, rashes, or anything? Any tattoos?
No.
Okay. And you already told me you didn't have surgery. Any problems with your feet? Are you having any problems with that?
No.
Okay. Then. Any back pain?
No.
Joint pain? All right then. Okay. I think we hit the highlights on all
I think
that.
we did a whole full body.
Yes, we did. We want to make sure. And you're not having any problems with your hearing, no ear pain, anything. Okay. So what I'm going to do now, I'm going to go ahead and address your issues. But I'm going to do an assessment. 4 months ago when you came here, they did a hemoglobin A1C, which tells you if you have diabetes.
Okay.
Okay. Did they start you on any medicines at that time? Are you on taking anything?
Not at the moment.
You're not taking any medicine at the moment, okay. And they would try to call you several times to give you your results, because your hemoglobin A1C was elevated.
Wow.
It was like 7 point something.
Okay.
Normal if you're not a diabetic, which means that you are a diabetic, and you do have a history. You say your mom has diabetes.
Yes.
And normally, if you're not a diabetic, it'll be less than 6. you know. So you right at where we probably need to be doing something for you, okay? But let me go ahead and do a physical assessment on you, and anytime that you have any questions, please stop me, because this is a joint thing. I wanna make sure you understand everything that I'm talking to you about,
Appreciate that.
okay?
Just step over here.
Yes, if you don't mind, get
Sure.
on the table, and I'm gonna ask you if you'll take your shoes off.
Sure.
Mainly because we take our shoes and socks off, so we wanna look at your feet, you've been a diabetic, okay?
Okay. Good thing I took a shower.
And if you didn't.
It'd be fine if you did.
Because they had a
I'm ex-military, it's okay.
You've seen it all.
Yes.
But they had a pedicure too.
You diabetic? Are you comfortable? I can let this out.
No, I'm perfect.
Okay, so what I'm gonna do, I'm gonna begin just looking at your just appearance. And a lot of times, the reason why I wanted to know if you, we'll take these off, so I
Sure.
see better without
Sure.
them on. A lot of times, what we do is, the reason why when you're diabetic, we want to make sure that you're doing yearly eye exam, because diabetes can affect your eyes. If your blood sugar gets too high, it can cause damage to the blood vessels, and some people lose their eyesight, it's called retinopathy.
I'm sorry, excuse me.
Cause retinopathy, which means the blood vessels are deteriorating behind the eyes. And sometimes you can have bleeding behind the eyes.
Oh, wow. Is that why I would get like my eyes would turn red, or is that something?
Most of the time you're gonna have blurred vision.
Dark vision?
You'll be able to see, and all of a sudden your eyesight will go. And I like to explain it to people like this. Have you ever seen a Jolly Rancher and what happens when the Jolly Rancher melts? I don't know if you've ever seen it melt, but Jolly Ranchers are really hard candy.
Right.
And if you think about the sugar planted on your blood vessels, in order to get all that sugar off your blood vessels, you would have to go in and chisel that away.
Oh.
There's no way they can do that.
Right.
So what we try to do is teach patients how to take care of themselves.
Okay.
And we'll go over a lot of that before before we leave today, okay?
Sounds good.
So if you'll look ahead for me, I'm just
Sure.
gonna look in your eyes.
Sure.
And most of the time, like, I'm just checking your pupils right now to make sure. Okay, if you open your mouth, and we talk about let me see.
The Bell's palsy doesn't.
Yeah, right, I understand.
Here we go.
That's okay, you don't mind. I'm just checking, making sure I don't see any bad teeth in there.
Sure.
A lot of times, the bad teeth cause other problems. Okay, good. And I did see you. Okay. And so we want to make sure that we're checking, getting our teeth done, because sometimes bad teeth can get infection and can go through your bloodstream. Okay.
Sure. Should I be like flossing every night? And of course, I brush my teeth. But should I be like flossing like with a water?
Oh yeah, you should floss. They always tell me floss the teeth you want to keep.
There you go. Love
So
that.
yeah, flossing is very important. Brushing is good, but flossing goes, I'm not a dentist, but I know
Right.
that flossing helps go the nose gum line and get anything that's stuck.
Right.
So they always say at least once a day, more if you can, okay? So if you look ahead, normally it's kind of dark in here, but a lot of times in order for us to see the back of your eyes, they usually dilate your eyes. So that's why I say go to the eye exam. But I'm just gonna look, I'm gonna get really close to you, okay?
Sure.
And I'm also checking to see if I see any cataracts.
Okay.
Try to look at the optic disc and all that in the back of the eye, okay?
Sure.
Cataract is prone in people who have diabetes too. So that's
Oh,
why we
really?
want to take care of those eyes, okay?
Yes, ma'am. Thank you.
Yeah, definitely. So now I'm gonna listen to your heart.
Okay.
And I'm checking for irregular heartbeat, okay? And as you were sitting there, I was already just making sure I didn't see any jumping of your heart. Keys and lifts and stuff. If you don't mind, lift your shirt up, please. Everything sounds good so far. I'm checking for murmurs also, okay? I want you to take, every time I touch you with the stethoscope, take some deep breaths.
Okay.
Yeah, yeah. Any pain when you do that?
No, ma'am.
Good. Here's your shirt. Okay. Yeah. Okay. Now listen right here. Then we're gonna go to the back. Okay.
Yep.
I'm gonna remove your shirt.
Sure.
Just a little bit up. Listen. Deeper. So far, everything sounds clear.
That's great.
I don't hear any wheezing or anything like that. And you said you haven't had any tenderness in your back area
No.
and around there? Okay, good. Okay, because I'm just trying to make sure that you don't have a kidney infection.
Sure.
So let me see your fingers. And right now, I'm just gonna check your fingers to make sure they're warm, because sometimes when you got diabetes and your blood sugar's not controlled,
Okay.
it would, cause your fingers to be numb and cold, okay? But
Well, what would I do if that should happen?
we would have to have your evaluations, because we wanna check for circulation to make sure everything is good. So just over time, if you take care of your blood sugar, I mean, I've actually seen people who, once they got educated on everything, put on the right medicines, their numbers stay below 7. I mean, sometimes they even go down below 6,
Wow.
and sometimes they're able to come off medicines.
Wow,
So,
that's amazing.
right now, you're not on any medicines that you tell me, and I just have to see if they ordered you anything.
Sure.
What was wrong, the reason why they couldn't get in touch with you? Do you remember what was wrong?
Working, going to school, and taking care of my daughter, I just neglected to
Okay.
follow up.
And I'm looking at his toes, they're nice and pink. I tell you what, it's a good job that you're doing that. What are you going to school for?
To be a paralegal,
Okay, all right then.
I take care of that daughter.
Yeah. So while you take care of your daughter, we gotta take care of you, okay?
Yes, ma'am.
And he does have good pulses. And we wanna make sure that you have good pulses in your feet also, okay?
Okay.
And I'm looking at his feet and, making sure that I don't see any sores. I do see a little callus right there, which is very important when taking care of diabetes, because we don't want that to get too bad, because that means somewhere you're rutting,
Okay.
okay, and on your shoes. So we gotta make sure we have the proper shoes. If your shoes are old, I tell people if they're over 3 months to 6 months old, if you're diabetic, toss them. Now, they do have special shoes if you needed to get them, called diabetic shoes, that most insurance cover them. Now, do you have any health insurance? Are you having problems with any of that?
No, I have good health.
Okay, good then, because we just, right now, so far, you don't need it. You
Okay.
probably just change your regular shoes and go from there. So, last time you were shown to be a diabetic was 7.0.
Okay.
The symptoms that you're having means that your blood sugar is elevated.
Okay.
So we probably would need to stick your finger today to see exactly what your blood sugar is. Did you eat breakfast this morning?
I had a bagel,
Okay, a bagel. Anything else with that?
cream cheese, and a tomato.
Okay. All right. Anything to drink?
Coffee.
Coffee with sugar, without sugar?
No sugar.
Okay then. So you're already pretty much in a, where you need to go. The only thing is with the bagel, it's fine, but you can add protein with it.
Okay.
Because protein, the bagel is full of carbs.
Right.
And carbs, when it breaks down, turns to pure sugar. And it's the sugar that our body can hardly use. It's what's gonna absorb the fat cells and all that stuff, okay? But pretty much, I think that's okay. Looking at your overall physique, it looks like you try to watch what you're eating.
Yes, no idea.
Okay, so today, we gotta get that under control. The last time your blood sugar was 190.
Okay.
And I don't know what kind of education that they gave you, but we really need to get you a meter
Okay.
so you can check your blood sugars and keep an eye on
Is that
it.
daily or?
Well, in the beginning, it's gonna be pretty much 3 times a day.
Okay.
And once it seems like it's gonna be stable, because we wanna see what it is in the mornings, in the afternoons, and what it is before you go to bed,
Got it.
okay? That way we can kind of get a handle on it. Because you didn't get started on anything last time, I'm wanna go ahead and put you on something,
Okay.
okay? And we can start out with metformin.
What is that?
Metformin is, it's a pill that we give, and what it does is, it's like a transporter. And what it does, it goes into your bloodstreams, get the blood sugar out the bloodstream, the insulin out the bloodstream, and it just transport it back and forth where they need to go.
Okay.
Usually you can start out with that about 500 milligrams a day.
Is that one time a day or?
One time a day. Would that be a problem with you?
No.
Okay. And then what we'll do, we'll keep you on that. And what I want you to do every day to check your blood sugars. And at the end of the week, you can either email it to us, or you can call the office,
Okay.
or you can drop it by. We want to see how your readings are doing, because
Okay.
if I need to go up on your medicine, then we want to go ahead and do that. Okay.
Awesome.
Right now, I don't think you need insulin. I just feel like if we get you on the right diet plan and making sure that you understand how diabetes works, I think you're going to be okay.
Sure. I hope so.
And another thing too, when you're exercising, you have to be careful that you don't put, if you're going to drink sports drinks, you gotta watch the sugar content. Now, if you're doing a lot of sweating while you're exercising,
Which I do, yeah.
yeah, maybe check your blood sugar.
Before.
Yeah, before.
Okay.
And just see what it is, because we don't want you exercising if your blood sugar is too low, you don't eat a snack. If you're gonna exercise your blood sugar is too low, you're gonna go ahead and eat maybe an apple or something,
Okay.
maybe a fruit, or maybe some protein. Because what happens with the sugar in the fruit, as you're exercising, your body can use that. Because it's a different kind of sugar. It breaks down and goes into our blood cells and our muscles and everything. We can use that, okay?
Sure, absolutely.
So today I would like to also do some lab work. Okay. I want to do a urine specimen on you, and that's just to make sure that you're not putting out ketones. Because sometimes you're putting out too many ketones. That's not good.
Okay.
Okay, we don't want you to have blood sugar so high when you go into diabetic ketoacidosis. Okay. And we want to make sure that we do recheck your hemoglobin A1C. So I'm actually going to do a complete CBC. We just go ahead and recheck all that, and then we're going to check the chemistry. Okay.
Okay.
I think that's all pretty much we need. Are you dating?
I am active. Yeah, I have a partner that we sexually active.
Okay. Any problems with that?
No.
Okay. Good, because I just want to make sure, because when I say sugar, it affects all the blood cells.
It's all,
It affects all the blood cells, okay? And I like to tell my male patients that, because a lot of times they feel like, oh, they're just trying to get me on the pill.
Right.
No.
There's a reason behind it.
Yeah, there's a reason behind it. Now, do you have any questions for me?
Yeah, I'm just, I've never, I know my mom had diabetes. What is it? So getting on this medicine that you mentioned, what are you foreseeing? How long I might be on this? Is this going to be a lifetime?
It could possibly be that you're on a lifetime. Seeing that your mom did have a history of it,
Okay.
it could possibly that you could be on a lifetime. I don't want to tell you no.
Sure.
And then if you don't take care of yourself, it's possible that you can end up on insulin too.
Wow.
Okay. Because diabetes, it can affect so much of the body. I mean, if people don't take care of their blood sugar, they can have a stroke, they can have a heart attack. They can end up with poor circulation. Some people have amputations. Some people end up on dialysis. So if we can get you control with one pill, your blood pressure and everything was good. It was just at 7.0. And the symptoms that you're having to let me know that you probably got diabetes. Yeah.
Wow.
Have you noticed any weight loss?
Yeah, I've lost a few pounds.
When you say a few pounds, how
I'd
many?
say about 4.
About 4. Okay.
Yeah.
So with you going to the bathroom and what you're doing, you're drinking and you're trying to put it back in, you're drinking, you're trying to put it back in.
Right.
A lot of times you can't get it back in. So let me just check your skin too. And what we do, we just check to see if you're dehydrated. So far that looks okay. Then I see your veins are popping up here.
Mm-hmm.
So I feel like once we get this blood sugar down, if I can see what it is today, sometimes if it's too high, we'll go ahead and give you a loaded dose of insulin.
Okay.
Okay? But if it's not too high, then we'll go ahead and tell you, hey, start this medicine right away. Okay?
So the insulin I want is if I'm taking this pill, I won't need to take like insulin shots or anything like that.
Yeah, it depends on what your levels are today, because in the beginning, sometimes if you're high, we will put you on a fast-acting insulin to get it down.
Okay.
And that'll be for like a few weeks. And then
Okay.
after that, then you can just go to the pill if your body responds good to it, okay?
Awesome.
But let me just tell you some of the symptoms that you can have
Sure.
from the metformin. Some people complain of having diarrhea.
Okay.
Some people complain of nausea.
Wow.
Some people complain of having weight loss, okay? Some people can get over it and they do good, and some people can't, okay? So if you're having those and it's getting bad and it's bothering you, please call us and let us know, okay? Because we have to get you back in and see what else will work for you,
Sure.
okay?
Got that. Thank you.
Any more questions?
No, I think I'm good. Thank you for all this valuable information. Like, really, I had no idea what it would be like to creating a world of having diabetes.
Yeah.
It's
And then-
something serious.
And then another thing too, you might wanna go ahead and have a class with your daughter, once you understand what's going on,
Okay.
and just let her know, because kids are really, really smart. Just in
Sure.
case, say for one day you decide you take your pill, and I know you don't have time to eat, you're running off.
Right.
And all of a sudden, if your blood sugar drops too low, the
Mhm.
symptoms are gonna be different. You're gonna be
Okay.
confused, you're gonna be lethargic, you're gonna be diaphoretic, it means you're gonna be sweating a lot. And so if that happens, then she needs to know, hey, just take some sugar and put it under daddy's tongue, or
Oh wow.
you know,
Good to
call,
know.
you know, just try to get me to eat something. And you'll be surprised,
Wow.
you know. I got a feeling she probably already tell you what to do anyway.
and she does. And it's really a good point that you know to educate our children so that they know in case something does happen to their
Right.
parents, they know how to react
Right,
or what to do.
right.
Totally.
And another thing I want to tell you, since you are, you know, working out at the gym and you're working a lot at work, you don't have to go and tell everybody all your business, just, you know, a person that you can trust. But you can also wear a bracelet to say, I'm a diabetic. Okay.
Okay.
Either a necklace or put it in your card, you know, and just something to say, this is what's going on with me. So if you get pulled over by the police or you done crashed into a wall, they won't think you drunk.
Right. Or no identity influence. Right. Totally. No, I got
Yeah.
that. Well, thank
So,
you. I appreciate
You're
it.
welcome. Just always make sure you're eating a balanced meal. And what we could do, we can come up with some information to give you
Okay.
so you know what a balanced meal is. A lot of
Okay.
people eat because that's what they normally do, but then sometimes they omit certain things that just bother to them. Carbs burn out our system really quick, but if it burns out, then the protein comes back. You grab the carbs and then it moves on, okay?
Okay. Got
All
it.
right,
Thank
Ed.
you.
Any questions?
That's all. Thank
Okay.
you. It's been a pleasure.
You're welcome.
Awesome. Thank you.
Okay, so I'm gonna do the blood work.
Okay.
Did they give you some cards to give me so I can scan them? Okay, I'm gonna scan them. I'm gonna take care
So,
of
are we
those.
officially stopping the recording or are we continuing?
I think we can stop now. What you think?
We can just start up if you.
Yeah, because I can't scan and record at the same
Yeah, I
time.
think you
Yeah.
see it this way.
Or you can use my phone to scan.
No, I'll just do mine.
So, then
Okay.
are you
All right.
stopping that now?
I'm stopping it.
Yeah, go ahead.